In the countries of Central and Eastern Europe and Central Asia, women represent approximately 20% of all people who use drugs. Like many other women, they routinely face gender-based violence at the hands of their partners, family members, or the police. Violence exacerbates the risk of transmission of HIV and other blood-borne and sexually transmitted infections, and negatively affects women's ability to practice safe sex and safer drug use. Fear of the police makes it extremely difficult for women to report violence, seek justice, and demand their human rights. On March 8, 2014, the Eurasian Harm Reduction Network and its partners from 16 cities in 7 countries launched the 3-year regional advocacy campaign, Women Against Violence. The first year of the campaign was run under the slogan Break the Silence and aimed to raise awareness of the problem among the police and decision-makers by mobilizing women and building their capacity to document and communicate police violence. The second year, the Year of Dialogue, focused on building partnerships between women who use drugs, law enforcement, and other stakeholders. The objective of the third year was to monitor police commitments to combat violence against women who use drugs. The campaign sought to empower women by putting them at the center of campaign activities. The campaign included a broad range of police-oriented awareness-raising training and capacity-building activities. The Eurasian Harm Reduction Network helped to create and maintain initiative groups and organizations of women who use drugs. It supported activist advocacy activities at the local level, their engagement in international advocacy, and their participation in regional and international events. Women were taught how to recognize and document different types of police violence and become a part of the Street Lawyers program. Following the first year of the campaign, EHRN partners established partnerships with law enforcement agencies in their countries. In 2015 and 2016, in conjunction with International Women's Day, community organizations in the region gave awards to law enforcement representatives, recognizing their efforts to support the community of women who use drugs. A total of 850 cases of police violence against women who use drugs have been submitted through a specially designed online platform. The majority of the cases documented related to threats, extortion, blackmail, and physical violence. The data collected were presented and discussed at national roundtables with law enforcement and other stakeholders. As a result of 3 years of work, women mobilized to address police violence. By participating in initiative groups, training, roundtables, and study tours, activists realized that community organizing can solve problems. The first steps were being taken towards mainstreaming issues of concern to women who use drugs into the global women's rights movement. Documenting violations helped women become aware of their rights. Their sense of dignity, confidence, and self-esteem increased as a result of the campaign, and a number of leaders and spokespersons on police violence emerged from the community. Joint participation in various events helped the police see women who use drugs in a different way. The police and authorities in several countries took concrete steps to address police violence and joined forces with activists to develop strategies and plans to respond to the problem. Women became better equipped to protect their rights. Training activities helped build the capacities of new and existing activists to enable them to confidently participate in decision-making about their own lives. The campaign also facilitated partnerships between activists and human rights organizations, police departments, policymakers, and other stakeholders. These partnerships resulted in positive changes for women, helping ensure their voice would be heard. Police officers also benefited as they were able to learn more about public health, HIV prevention, and human rights. These developments helped lay the groundwork for the new project, Women for Humane Drug Policy. This project aims to improve access to HIV prevention and treatment, harm reduction, reproductive health, and social support services for women who use drugs in Russia and Ukraine, as well as in other countries of Central and Eastern Europe and Central Asia, by promoting alternative approaches to punitive measures for drug use and possession for personal use.